Good afternoon, everyone, and thank you for joining us for Making It Work. Our topic today is expanding telehealth. I'm Courtney Spencer, Vice President of Advertising for the Portland Press Herald. Today, Press Herald Business Projects Editor Carol Coultas will be moderating our panel discussion on the future of telehealth in the wake of all that has happened this year. Before we begin, I would like to take a moment to thank our generous sponsors for their support of our programming. They are Harvard Pilgrim Healthcare, MEMIC, Cross Insurance, Katahdin Trust Company. To get us started, I'd like to introduce Tony Payne from MEMIC to say a few words. Tony?
Welcome, everybody. I'm Tony Payne from MEMIC, and I just wanted to thank the Press Herald for being the forum, as it has been so diligently throughout this challenging period that we've gone through with the pandemic. Getting good information out to particularly our small business owners across the state has really helped, I think, let everybody know that we are indeed all in this together. As a workers' comp insurance company, this particular topic of telehealth has great significance for us as well, because we want to make sure that all the employees who are covered through MEMIC have access to quality health care in a timely fashion. And with 18,000 policyholders across the state of Maine, our job is to make sure that we're getting them treated with compassion through trusted partnerships and relentless commitment to safety. And the trusted partnerships part of our mission really has everything to do as well with the quality of healthcare that's delivered through our healthcare professionals. So please enjoy today's event and ask good questions to make sure that you can take full advantage of a telehealth relationship.
Thank you, Tony, for your partnership, and thank you, MEMIC. And now we'll turn it over to Carol and her panelists. We hope you find the discussion interesting and useful.
Thank you, Courtney. Welcome, everyone. We're delighted you can be here this afternoon. It was just about a year ago that Craig Anderson, one of my colleagues in the Press Herald newsroom, did a really good story looking at where telehealth was in the state of Maine. And at that time, about 5% of the medical services delivered in Maine were delivered over an internet connection or a phone line, which is generally how we define telehealth here in this state. But there was a consensus that it should be closer to 25 or 30%. And that's because telehealth has been shown to be particularly effective in doing things like managing or monitoring chronic health conditions like diabetes or COPD. But what was standing in the way of that were numerous factors. One was that although the state has been progressive in terms of mandating coverage parity, if you're a private insurer or if you're getting your care through Maine Care, you have to be covered for telehealth services as you would be for in-person services. But there was a gap, there was a hole in that policy that didn't require payment parity. And so for a lot of healthcare providers, they had a financial disincentive to expand telehealth services. Another problem was spotty broadband in the state, which is something that we've been talking about endlessly for the last 10 years or so. And further, it was another really big problem was that Medicare, for the most part, wouldn't cover telehealth services. That's a huge issue in the oldest state in Maine. In fact, Fitch Ratings had done an assessment and projected that by 2026, 1 in 4 Mainers will be 65 or older. And Maine Health Data Organization looked at medical claims filed over a 1-year period from June of 2016 to July of 2017, 16 million claims, and 10 million of them were filed under Medicare. So having access, telehealth care access to Maine's older and more rural populations has been a significant objective, and why all of our congressional delegates keep pushing for expanded Medicare. So expanded telehealth services. So that's where we were a year ago. And then suddenly fast forward to March of 2020 and boom, a pandemic hits. And suddenly nobody wants to be in any kind of public setting, never mind a healthcare facility where you think your chances of running into someone who's sick is greater than if you just stay home. And Maine's healthcare systems responded really quickly and really well. For example, Martin's Point, they had a 12-month plan to roll out telehealth services throughout their system. And instead, they got that up and running within 2 weeks. So necessity being the mother of invention. And so now we're still, sadly, in the middle of another surge of this pandemic. And there are a lot of questions around telehealth. And part of that has to do with regulations that were changed at the congressional level to allow the expansion of telehealth during this public health emergency. And there are concerns whether those temporary changes will be made permanent once we get through COVID, or if we're going to revert back to our pre-COVID status. It's problematic for a whole lot of reasons, but particularly for the healthcare systems and their planning and how they can deliver healthcare to a greater percentage of Maine's population. So that's sort of where we are today. And I'm delighted that we have 3 really great experts to talk about this issue here in Maine. Oh, I should have mentioned. So that's what was happening with the regulatory side of things. On the private side of things, a lot of insurance companies are now integrating telehealth into their coverage policies. And for self-insured companies in Maine, there's been a greater demand for those services. So there are lots of things moving on different levels here in the state. And for that, we have 3 terrific experts to talk about where we are and where we can go, the potential and the challenges that surround telehealth. First, we have Danielle Louder. Danielle is the director of Northeast Telehealth Resource Center. That's part of a national consortium, and they are dedicated to growing and expanding telehealth services across the country. And Danielle is responsible for New England. From her offices in Augusta, she's responsible for New England, New York, and New Jersey. Also joining us is Jasmine Bishop. She is the director of telehealth for Maine Health, which, as you know, is Maine's biggest healthcare system and also the state's biggest private employer. And so Jasmine has been working for the last 3 years on developing strategies and initiatives to expand telehealth throughout the Maine health system. And also joining us is Rob Sprang. So Rob is the director of Telecare services at the University of Kentucky. And I'm sure you're wondering, why the heck is there a guy from Kentucky on our panel? But he's here because he's been involved at a state and federal level on a lot of initiatives around expanding telehealth, but also because about 10 years ago, he helped a mining company in Kentucky that was facing catastrophic, costs that were connected to catastrophic illnesses among its employee base, miners, people who were, digging underground for 12 hours a day, and was desperate to change their outcomes. They were trying to get a handle around having a lot of older workers, a lot of sick workers, and how could they change their healthcare model to one that prevents the situation rather than trying to remediate that situation. So those are our panelists. Let me start with the first question we have, and that is that telehealth services have exploded nationally and here in Maine because accelerated by the pandemic. So can you talk about the scale of the growth you're seeing and how that has affected the delivery of healthcare, particularly to some of Maine's most vulnerable populations? And Jasmine, I'm going to ask you to start that because you told me some just mind-blowing statistics from Maine Health's perspective. So take it away.
Thanks, Carol. Yeah, I'd love to share the experience of Maine Health and the patients that we serve. So we saw in our time prior to COVID, typically about 2,000 video visits. That's essentially what we're doing here between a patient and a doctor. And in the time of just around March 12th or so, when we had our first COVID case in Maine and the public health emergency was announced nationwide, we ramped up video visits so that all of our practices, more than 200 practices across the system, could offer this option to patients, so that we ended up seeing over 30,000 visits per month in the March to June timeframe. And so that we're talking about more than 1,000 visits per day, equaling about what we were doing in a month prior to the pandemic. And so what that means is that these are patients, our communities that are staying healthy, continuing to receive care from their providers, and reducing their own exposure to the virus, as well as reducing our care team's exposure to the virus to ensure that they can continue providing care across the community. So we're really proud of that opportunity, and most of that was completed because of the enormous amount of resources that were thrown towards telehealth. You referenced it briefly, but there were significant changes to the reimbursement policies. There was and still are waivers that allow for us to provide care to patients' homes in different ways than we were ever able to before.
Great. And how about you, Danielle? What are you seeing from a statewide perspective?
Sure, and maybe even to go a little bit higher, 100-fold increase in Medicare claims for utilization for telehealth visits during that same time frame, that spring time frame. And from MaineCare's perspective, our colleagues there have reported just, typically in 2019, just a few hundred month by month, up to 90,000 visits in March and April timeframe for telehealth. So very similar phenomenon, and it's really amazing how folks, providers across the state, for patients and clients, just really pivoted so very quickly to ensure that folks had access to preventive services, COVID-19 related services, mental and behavioral health services. It's just been a huge benefit and very vital to ensuring access to care during this tough time. So, and if you'd like an example of vulnerable populations and how, sort of some of how the policy expansions have really enabled us to help some of those vulnerable populations, the expansion of that telehealth policy under the public health emergency has allowed federally qualified health centers and rural health centers across Maine, across the nation, to act as distant or provider sites, which was not allowed, specific to Medicare before the public health emergency. And FQHCs and RHCs, as folks know, see our most vulnerable populations, particularly those in rural and underserved areas. And so this policy expansion has been huge in allowing them to provide access to that care for these patient populations during here in Maine and well beyond that as well.
So did those rural providers, were they able to get the infrastructure up and running in order to meet that demand, Danielle?
In many cases, yes, they may have had some services, and they were acting as originating sites. So the patients would come to them, and they would receive services from a Maine Health or from one of the other systems here in the state of Maine, and they would get a very small reimbursement called a facility fee for that. With opening up this policy, they were able to then use their own providers to also, provide vital services, whether it be primary care, COVID-related, mental and behavioral health related services. So yes, it was definitely investment in technology. A lot of the other key consideration was that patients, because they didn't want to be, or they couldn't be exposed to COVID, they were receiving services from home. Providers may have been providing services from home. And so again, these policy expansions to allow for a lot of that, these flexibilities, has been so very important. I will say, that while our folks in rural and underserved areas were able to tap into many funding mechanisms, the federal, the FCC, the USDA distance learning telemedicine program, some folks were able to access funds through that. Our health systems invested a lot of resources in ensuring that folks were able to get the technology in place. The great thing is technology, the price has come down as things become more available. And in many cases, like this video conferencing today, right? All of us, it's ubiquitous now, and it just takes a nice video camera and kind of using your website manner or video conferencing etiquette, but it doesn't take a whole lot of technology. It's the lack of access to broadband, and with patients and providers being at home, that's been, and I'm sure we'll talk more about this moving forward, what some of the key barriers, and you mentioned it early on, those are the things we've got to keep focused on.
Okay, thank you. And Rob, how about there in Kentucky? Are you seeing a huge influx of people receiving healthcare through telehealth services?
Yes, certainly. And I don't think that, I don't think Danielle's point can be understated, that it sounds like a lot of the work that you did, and certainly a lot of the work that we did, was traditional telehealth from one healthcare facility to another. The pandemic changed all that. And the reason that it changed and the reason we're able to do it is that legal and regulatory language was changed to allow payment for patients that are at home. And so before the pandemic, 90% of our telehealth work was done between two healthcare facilities. And now 90% of it is being done in the patient's home. And I don't see that walking back at all. So I think that the access to healthcare is going to exponentially increase because of what we've done with telehealth.
Interesting. Well, Danielle, one of the things you mentioned to me when we had our conversation before this event is that you're seeing a lot of Maine companies that self-insure asking to have telehealth services written into their policies. And I'm wondering what's driving that. Can you talk a little about that?
Sure. Great question, Carol. I think there are a number of drivers. Certainly, while the complexity, as we described, of the telehealth policy landscape has been a big challenge to widespread adoption, in many cases, self-insured companies really have that more flexibility that others don't when negotiating services covered in their benefits plan. And so this certainly makes it easier for them to include a cadre of services that are relevant to their workforce, including telehealth. Of course, we still need to be cognizant of, particular health professions boards and things like that. Those providers always will have to follow those. And that's where, if you have questions and you want to dig into the weeds with that, call the Telehealth Resource Center. That's what we're federally funded to provide free technical assistance and resources to figure that stuff out. So give us a shout if you need that. But also the literature around the benefits of telehealth has continued to grow over the years, including increased access to a broad spectrum of care. Patient and provider satisfaction is very high. And during the pandemic, they've also released news articles, et cetera, that's very high. Decreased hospitalization and exacerbation of disease, and subsequently those decreased costs and improved quality of life for patients. These benefits alongside those specific to the work site, I would say, including decreased absenteeism for employees and their dependents. Think about having to leave work to take a kiddo to the doctor's office. We have programs that are linking, the parent might be out in their car during the workday, so they're only missing an hour of work versus the whole day. Decreased claims and premiums due to access to timely care. So they're not delaying care because they don't want to miss work. And others are really those key drivers in increased adoption among work sites, and particularly within the self-insured companies.
Oh, interesting. Jasmine, are you seeing the same thing? Are you seeing the healthcare, the insurance companies that you see, are they also asking more questions about telehealth services and what can be included that are, I know that come January, there's a whole raft of new service codes that will be allowed. So are you hearing that from the healthcare insurance, the health insurance companies that you deal with? Heightened interest?
Oh, absolutely. Not only is there heightened interest in what to cover, but there's also been an insurgence of grants available from our health plans. We've been very grateful to receive multiple grants. And what these grants do is they allow us to test out a modality in a certain patient population to do some research and understand the clinical outcome. Because while we see telehealth being used in a volume that we've never would have anticipated so quickly, we still don't have a full understanding of the long-term clinical impact of the use of video technology and remote patient monitoring and other telehealth modalities. So here at Maine Health, we have several health plan funded grants to look at those clinical outcomes. And so that's one of the areas that they're really making a difference, so that we can dedicate resources to not only doing the work, but to ensuring that the work is making a positive impact for our patients' long-term health.
So it seems like there's a lot of investment on sort of throughout the whole healthcare system, the people who are providing the care, the people who are providing insurance for the care, and the people who are receiving the care. it seems that its time may have come, perhaps. So let me turn the conversation to you, Rob. Can you talk about your experience with Alliance Resources and why they decided it was a very risky decision to go ahead and embrace telehealth in the way that they did? So can you talk about that company's experience, please?
Sure. So Alliance Healthcare Resource or Alliance Resources is a coal mining company that reaches into 8 different states across the country with significant facilities in Kentucky. This company, like many companies, was seeing double-digit annual increases in the cost of healthcare. Unlike other companies, this company decided to do something that was really patient-focused and patient-oriented. A lot of companies faced with this kind of increase in cost have moved to high deductible, almost catastrophic healthcare plans. That has the opportunity to lower healthcare cost. It also is a disincentive for patients to go to the doctor because they just can't afford it.
Mm-hmm.
What Alliance decided to do, and this is a company that was spending $80 million a year on healthcare, decided to take telehealth, create the foundation of an entire employee health program, and they put healthcare clinics in every one of their mining facilities. They put a nurse or a nurse practitioner at every mining facility. And again, they brought healthcare closer to the patient. And not only that, but they eliminated all patient contributions to healthcare. No deductible, no annual cost, no prescription cost. What they were able to do was uncover chronic disease and chronic illnesses that were essentially devastating the workforce. The guys that work in the mining business, they're underground 10, 12 hours a day. When they come out of work, the last thing that they want to do is have to go to the pharmacy, have to go to the doctor. And so the company brought healthcare directly to them, both through telehealth, as well as brought their pharmaceutical supplies directly to the workplace. And what they found over the years is that not only did they reduce the overall cost of care by investing heavily into preventative and primary care services, but they were also able to increase outcomes, that these employees average 54 years of age. It's really important to keep them healthy. And so they found that they could lower the cost of healthcare. And this is a company that reduced per member, per month healthcare cost every year for the last 10 years. That's
Wow.
unheard of. Nobody does that. And so, and as you said, in addition to reducing cost, they also reduced absenteeism by 20%. So it had a tremendous impact on the company. But as you said, it was incredibly risky because they didn't know this would pay off, but it did in a big way.
So just sort of following up on that, Rob, excuse me, is there general advice that you can offer to companies that are thinking about how can they integrate telehealth services for their employees?
Yeah, look, you've got to be a pretty good sized company to build telehealth into all of your facilities. But what I would ask employers to consider as you look at integrating telehealth into your insurance plan, one of the things that you should consider is that many insurance companies align themselves with national telehealth programs. And the only downside to that is that these programs often use providers from all over the country, and they have a tendency to bypass the patient's general primary care provider. And so you often lose continuity of care. So I would suggest to companies, make sure that you make allowances for telehealth, but do everything that you can to make sure that patients remain closely tied to their own providers, especially their primary care provider.
Great, thank you. And Jasmine and Danielle, would you like to weigh in on this? What advice do you have for business owners and managers who are interested in integrating or expanding telehealth options for their employees?
You want to hop on first, Jasmine? Okay, so just like in any environment, in follow up to what Rob mentioned, is carefully knowing your population. It's a team effort, right? You've got to know, and there are some very diverse populations, even within the same organization, right? So you really have to know their needs, what's driving your costs as an organization, but making sure that the solution is user friendly. Oftentimes we encourage folks to kind of start small with what are some of the biggest claims in your organization that are really having an impact? Why not start there with your first, telehealth program? Making sure that you're working with employees, that it's a user-friendly solution, it's not overly complex. It's those types of things, the logistics. If there are, groups you have groups of folks who are constantly on the road, make sure that your coverage includes that telephone only component, because they may not have access if they're out, plowing roads or, things like that, that they can still access those services, whatever the environment is that they're in. And so just really being careful to understand your employee population and ensuring that your benefits package includes, specific to telehealth, those things that are really going to help you meet your employees' needs and meet your organizational needs.
Great. Jasmine, what about from you?
I would just like to acknowledge the many businesses that have had to send their employees home. The purpose of making sure that we stay safe, especially as we've seen these cases tick up, unfortunately, in the last few weeks. So we're sending employees home to keep them safe, but then they still might have to go physically into a practice that increases their exposure. So telehealth is that opportunity to ensure that you've done the right thing by sending your employee home. Let's give them the opportunity, if it's clinically available to them, to stay home for their doctor's visit as well. And that's really what the value proposition is, especially during COVID, of telehealth overall, of that traditional telemedicine modality. I did want to add one idea of telehealth that goes on behind the scenes that you might not be as well aware of, and it's the concept of e-consults. And it's that opportunity for doctors to talk to one another about your patients or yourself, your own care. And so what this does in terms of how it will impact businesses is if I go into my PCP's office for a well visit and I have a rash and I talk to my doctor about this rash, they might typically have referred me out to a dermatologist, which that means I have another time I'm going to have to take time off of work to go to that dermatologist appointment. But with e-consults, my PCP would be able to take a picture of my rash, send it electronically to the dermatologist to get a medical recommendation, and then come back to me over phone and say, hey, good news, I have the medical recommendation and here's your prescription. And now I have peace of mind because I didn't have to wait for weeks or maybe even months for a dermatology appointment. I also don't have to take time off work again for that visit, whether it's in person or over video. It's still time away from work. And you have the real benefit for our patients of not having to travel, during COVID and having that extra exposure. Again, another interaction with a clinical setting. And we're seeing in our health system that 90% of our patients for this specific dermatology e-consults do not need to be seen by the dermatologist after using this tool. So it's really a different way of thinking of telehealth, but it certainly falls under the umbrella of telehealth as well.
Oh, that's really interesting. Can we talk a little bit about where your concerns are about the waivers and the ability to expand telehealth under the current regulatory framework? I know on Friday, Senator Angus King released a press release saying that he and many stakeholders from the state of Maine had been meeting with the Bipartisan Resource Center about strategies to make what are temporary accommodations for telehealth permanent, as in recognition of the way that could benefit a lot of people within the state of Maine. So what are the concerns about those regulatory changes and the temporary nature of them?
Sure, I can hop in with a start, and then Rob and Jasmine can provide additional. So we've been getting lots of questions and around this, of course, over the past few months. And boy, do we wish we had a crystal ball. Unfortunately, we don't. The good news is, and as you mentioned, Senator King has been a huge proponent for broadband expansion and telehealth in general, but the current public health emergency is extended out toward the end of January 2021, right? So all of these blanket waivers are in place until then. While we can't say for certain heightened numbers, significantly heightened COVID numbers on top of flu season, many are anticipating that will be extended again. And so we will continue to have these blanket waivers. Maine, for example, and many other states are using like a month-by-month extension of their executive orders and public health emergency policy changes. But as you might imagine, folks are concerned. When will it end? What will it mean? And the biggest difference is some of these changes can be made permanent via regulatory process, which is much less complex. For example, the proposed physician fee schedule for 2021 came out early in the summer. There was an open comment period through October. Those typically move forward and get enacted in January of the next year, and there typically isn't a lot of issue with that. Some of the expansions that would become permanent under this year's would be like, and we can't get into all of them here because we don't have time, but for example, it adds select codes allowed under the PHE permanently. It also proposes removing some restrictions or exclusions of telephone, email, and fax under those telecommunications codes that are allowed. And so those types of things are fairly easy to move forward permanently. The other part is that it has to be changed via law, in other words, an act of Congress, which we know that is more time consuming and more complex. Those are things like the rural eligibility requirements that Medicare has had for many, many years and has been a huge barrier. That's just one example. The patient being able to receive services at home as the originating site, that's something else that takes a change in law. The great news is telehealth, as you mentioned, Carol, is a bipartisan issue. I think there are 15 bills on the floor right now being considered to permanently expand many of these issues that have been barriers for many, many years. So that's really great news. It's just, we may have to wait a little bit to get those laws passed. But we know, folks with COVID continuing to go on, and that the detriment that it's having on folks if they aren't able to get access to care, that there's a whole lot of thought and work going into making these changes. So that's all very promising. And then I'll let Rob and Jasmine hop in and add.
Yeah, historically, Medicare has been actually a little slower to the game to open up reimbursement for telehealth, much more restrictive, much more limited than a lot of our states are. And I think as business owners, you all are probably going to be much more interested in what's going to happen at the commercial health plan and the Medicaid programs in your state. And I would just suggest to, as the regulations are considered to roll back, if that's what happens, I would suggest that be active advocates for this. It's historically, I think that people have been slow to adopt legal and regulatory language for telehealth because it was typically us, the medical centers, the providers, the people that would actually benefit by getting money from those payer sources. I think what you will find today is that the patient population has been exposed to telehealth, and the voters are going to be a very powerful advocacy group. So I would suggest help to motivate your employees, lead out as employers, and make sure that you push your states, both Medicaid and commercial health plans, to cover for telehealth services.
Great
Just
advice.
Super quick follow-up. Maine has actually already expanded several of their public health emergency policy expansions for telehealth. Maine is a leader with respect to telehealth policy across the country really, and has been for quite some time, just because it really does cover a broad variety of services. And they have already permanently expanded. That was enacted in June 2020. So just wanted to make that point that we do have a really great environment here as far as our Medicaid and our commercial payers we've had a mandate for telehealth coverage for over a decade.
Great. And so Jasmine, what are you watching for Maine Health's benefit? What are the regulatory concerns that you're following closely?
I think one of the ones, in addition to all that they've already brought up, is the phone payment. Phone has not been traditionally considered telehealth, but we've seen the need for it to be considered telehealth, for it to be paid as telehealth, and to continue to be paid. The biggest reason for that is we're in Maine. We have a significant rural population, most rural states. We also have snow and mountains and islands, and all of these barriers, natural and otherwise, create a situation where not all of our patients, our communities, have adequate broadband to support the enormous amount of data that it takes to run a video call. Before this, we were all joking about how we did everything possible in our own environments to make sure we were able to take control of the broadband in our space, because we know that video takes up a lot of data. And not only is it an infrastructure issue, it can also be an affordability issue. Data is expensive. And some of our patients, they might have phones, but they don't have a data plan that can support the video calls, even if their phone device technically does have a camera on it. So there's both an accessibility and an affordability issue that we have. And so we are really focused on making sure that those phone visits can remain paid for, because it's an access issue. Overall, when I think of telehealth and the importance of telehealth, it's increasing access for our patients. Every time a payer offers another code that can be billed, that's access. Another type of provider beyond just a doctor, LCSW, speech therapist, that's access for our patients. And one piece that we don't have in terms of access, we often refer to it as the digital divide, and it's that combination of the broadband piece, devices, it's the accessibility and the affordability. And so phone calls or phone lines are ubiquitous across the country. Most people have phone line available to them. Most of us don't take advantage of having a hardwired phone line to our homes anymore, but it's there. And I think one of the things that Senator King mentioned on Friday that was really important in his bipartisan policy center webinar was the fact that there was a nationwide commitment to ensuring that we all had phone lines decades ago. We need to do the same thing for broadband, because it is impacting not only our healthcare, but it's also impacting our children and their ability to get education right now.
Yeah.
And then there's the whole economic development side of things, right? Keeping people in Maine to work here and lead productive lives here. And so it's cross-sector, so we can all get behind that and support it.
Yes, yes. Well, I see that we have 12 questions already lined up in the queue. So I had a couple more questions, but we're going to just put those aside and get to the audience questions. And I want to actually ask the first one that came from someone who registered for this. They submitted a question when they registered, and that is, how can you ensure the security of your medical care over a video line? What are the issues around hacking or cybersecurity? And so I'll just get that question, because I think that's top of mind for a lot of people. So Danielle, you have the floor. So go ahead and continue on there.
Okay, sure. So that is often, a concern. Clearly, when you're working, with a healthcare system, a healthcare organization. And pre-COVID, there were very strong restrictions with respect to HIPAA, Health Insurance Portability and Accessibility Act, high tech. And it was required that the technology solutions that were being utilized for telehealth were HIPAA and high tech compliant. Under the COVID-19 pandemic, though, there's much flexibility around that, right? So folks have been able technically allowed to use things like, Skype or FaceTime, things that they might use with their family on a day-to-day basis to connect and stay socially connected, et cetera. What we've been encouraging folks to do is, for obvious reasons, one, to protect privacy and security, is to use a HIPAA compliant solution if at all possible. And knowing that those restrictions are likely to come back to where they were pre-COVID, if you haven't been using a HIPAA compliant solution, to start moving in that direction and to really talk with different technology vendors, telehealth solutions, to ensure that their solution is HIPAA compliant and that they will sign a business associates agreement with you, because that really provides all of those high level protections with respect to security, et cetera. So, the technology gurus can really get into the nuts and bolts with why those solutions are incredibly secure and protected. But that's just a start to that. And I'll let Rob and Jasmine jump in and provide additional.
Let me just ask a question though. So Danielle, so the onus is on the healthcare providers to put that layer of security on the technology. It's not like everyone's cell phone, you're suddenly going to have to download some new kind of app or some kind of new security for your phone or for your laptop. The onus is on the healthcare provider.
If you're receiving care through that healthcare provider, then yes. We would always encourage folks, if you're receiving healthcare services via telehealth, you think about your banking and how very careful we all are around that, to make sure we're following correct protocols, being safe, preventing fraud, making sure that we're not, clicking on links from people that we don't recognize. It's those types of kind of commonsensical things that we've all been sort of taught over the last few years to protect our privacy with respect to healthcare or our finances, et cetera, that are really important to follow. But yes, when you receive a link to, receive services from a healthcare provider, you click on that link, it goes through a secure system. Having what the healthcare providers cannot control, if a patient is in a public area and they take a call, they can't possibly protect against that, because that's the choice of the patient or the client to be in a non-secure area. So it's about location, environment, but it's also on the back end about the technology, the infrastructure, et cetera. And that's where the
yeah, I think that's an important point, Danielle, the difference between the technical security and the process-based security, because we have encryption layers, and Maine Health has chosen to continue to use only HIPAA compliant platforms. There's, as an example, Zoom that we're on right now that is not HIPAA compliant, and then there's healthcare level Zoom that is HIPAA compliant. And so that's a technical security. And then there's the process security that Danielle was just speaking to, the need to make sure you're in a private space. If any of our doctors are in a shared office, or if there's anyone else within earshot, they are required to let the patient know, I have Jasmine here from telehealth. She's watching the visit today. Is that okay? And the patient's allowed to say, I'm actually not comfortable with that. And not only do we make sure that the patients have that opportunity to know who's in the room, because you would have no idea if I have someone standing right behind my camera right now. And that's a big difference between if you're in an exam room, you can look at all four corners and see there's no one hiding in one. But there's also the need to ensure that the patients, as Danielle mentioned, are taking care of their own security, and that we understand what they want for security too, because some patients might be in a family home where they didn't want to share their healthcare concerns with that family member. And so ensuring that they think about that ahead of time, go into your private room, or schedule the visit at a time when that family member is not in the home. And so those are some really key security measures that both sides should be thinking about, just making sure that your own healthcare information is protected as both the providers and our health system's responsibility, as well as individual patients.
Right. Rob, if you don't mind, I think Jasmine and Danielle did a great job answering that question. And since we have so many in the queue, I'd like to turn it over now to the questions that are lined up for Strawberry. So Strawberry, could you give us the first question, please?
Sure. So we've got a question from Mark. Are there any developing applications to enhance telehealth visits with in-home biometric devices?
Yeah,
I can jump in on. Oh, go ahead, Rob.
No, you can go to Best Buy. I mean, it's amazing. There's a company called Telecare that has created a little device that's smaller than your fist. And it is most of the medical peripheral devices that you would find in your primary care provider's office. You can look in the ears, the nose, the throat. It's a stethoscope. It is a thermometer. It is all these devices in one, and it'll connect through any of your video conference platforms for a robust telehealth visit. So when it, and you think about it, their intent was to allow the Geek Squad team at Best Buy to be able to support this. I think you're going to see a wealth of this kind of broad-based integration in the retail marketplace. So yes, it's available and it'll become much more available.
Great. Let's go to the next question then.
Let's see. With telehealth brings the opportunity for patients to be located anywhere, including out of state, are there any conversations around changes to licensure or credentialing to support telehealth expansion?
Yes.
Wow.
Can I leave it at that? No, it is more complex than that. And fortunately, states and the federal government also acted very, very quickly during the pandemic. And the Federation of State Medical Boards is a great website to find state-by-state information around this cross-licensure issue. For previous to the pandemic, there were restrictions, and it basically stating that if you are a provider in let's say Kentucky, because that's where Rob's from, and you want to provide services to a patient in Maine, you had to be licensed in the state of Maine because that's where the patient is located. There's lots of flexibility around that right now. In fact, Medicare is allowing that to occur, cross-state care to occur in all 50 of the contiguous states. Each state is a little bit different. Maine also included flexibility with various type of providers to be able to provide care in other states, whether their patients were traveling or maybe they had to go take care of family in another state, et cetera. So it's really important to know which state you're talking about. But then more long-term, there's been some compacts for different disciplines, whether you're a physician, a nursing compact, which Maine has been part of for many, many years. Maine is part of the physician compact. There's an EMS, an emergency medical services provider compact, and there are others, psychology, I think, and there are more. And certainly when we recognized how really not well prepared we were to respond to this pandemic with this whole cross-state licensure thing, as well as other key considerations, this is definitely on the table to expand. The whole idea of these compacts is to really decrease the burden associated with all the licensure, the credentialing, all of these things that get in the way of very quickly being able to serve folks in other states. Well, we certainly want to have, Maine providers providing care to Maine patients, that whole continuity of care, et cetera. But with a workforce shortage, these things are going to become increasingly challenging to provide care, specialty care, et cetera. Mental and behavioral health, we have a huge shortage there, and folks are struggling. They're not getting the services that they need for substance use disorder, et cetera. So I'll be quiet and let Rob and Jasmine hop in and provide a little more around that if they'd like.
Look, I'll give you the example that my daughter is a psychologist, works for the Wounded Warrior Foundation out of Emory University. And at the point of the pandemic, when they knew they couldn't travel the vets to her clinics, she got licensed through the compact in 15 other states and now delivers care all over the country. And it's good to hear that Maine is a part of those compacts, because that will expand your access. But I also think Danielle is correct. You want your people seen by your own in-state providers as much as possible. And so not to downplay the compacts and the opportunities to see other providers, you really want to keep healthcare local, and that's the whole point of telehealth.
Yeah, and I'll just add to that last point, Rob, that why we want to keep it to the state level, because in your state, in Maine, we know the resources that are available for the patients. Maine Health has a fantastic access to care team that can share with patients how to get reduced cost drugs, where to get public health services. And the services are very region specific. And so it's important for our patients and for employees, our communities to be able to stay local so they can have that sharing collaboration of resources and understanding of what's available, which really does impact care. We talk a lot about the social determinants of health as being something that is far and beyond just the clinical needs of our patients. And that's where these resources come in.
Oh, those are all great answers. Thank you. Strawberry, we have another question. We're down into the single digits now.
Yeah, are there any clinical guidelines either under development or that currently exist on how best to provide clinical care virtually?
That's funny because I was literally just typing an answer feverishly in the chat to try. I was like, oh, I can pick this one off. The answer to that is yes. And in some cases where there's stronger literature, mental and behavioral health, for example, telepsychiatry for pediatric, there's been a number of experts over the years that have developed these guidelines and recommendations. Certainly, if you're looking for a specific use case and guidelines and recommendations, reach out to us, any one of us, and we can provide you with the documentation for that. So yes, and during COVID-19, there have been new use cases. So we anticipate continuing to see additional guidelines. And so of course that's on, the standard sort of overall level, but then within each healthcare organization, and Jasmine and Rob can say more about this, you're developing those standards, those protocols that really help you internalize and protocolize it on your local level.
Anyone else want to weigh in on that?
I'll just add that it'll also impact our ability to increase access to care. The better we are at knowing which visits are best suited for telehealth, the quicker we can schedule them as such, and then potentially have the opportunity to schedule and see more patients throughout the day and be more efficient with the patients that we do see within our system. And with the partnership with the Hannaford Simulation Center, we did a pilot during COVID, or still during COVID, but during the initial surge, looking at providing more of that website manner that Danielle mentioned early on for our providers, because it's much more difficult to provide the same level of medical care that you're used to providing over video. There's a wealth of information on how to do that effectively. One of the key ways that you can do that is using like proxemics, leaning in to deliver some kind of, I'm close, I hear you, I'm right here, leaning back to say, I'm giving you space to have the sensitive discussion. So there are things that you can do in the video and virtual environment to create some more of that compassionate care delivery.
Great, thank
We
you.
have a question for Jasmine. With grants for research on long-term effectiveness, is telehealth via phone being considered separately, since this is so important for our rural and low-income patients?
That's a great question. Most of our grants are actually focused right now on the video visit component, just because of there's a assumption that there might be a harder bet of getting the reimbursement to stick around for phone. We're working really hard on it, but in terms of being able to develop a longitudinal research project, we are focusing on the video visits because of our concerns of reimbursement on the phone side right now.
Great, next question, Strawberry.
I've heard that older providers are often averse to working in a telehealth environment. How common is this, and what is being done to help bring more providers truly on board?
And look, for most of us in healthcare, we have experienced the migration to electronic health records over the last 15 years. I know physicians that retired because they would not move to an electronic medical record, and it's mandated for reimbursement. Don't assume older providers won't do this. We have older providers that know how to develop a rapport with a patient, and they do extraordinary well with telehealth. So don't make the assumption this is just for younger patients and younger providers, because we have seen across the board people accepting this.
Have you seen that in Maine as well, Jasmine and Danielle? Jasmine?
Absolutely. During this past 6 months, we provided care over video to over 50,000 patients, and a quarter of them have completed our telehealth surveys. And I'll say that in terms of the highest rates of satisfaction, second only to pediatric population is our 65 and older patients. And we have great qualitative data coming from patients that say, I'm 85 years old and I've been doing this, and 96 years old. Yes, I had help of my great grandchild that helped me do this, but I did it and it was great. And these are the population that are most vulnerable right now. Telehealth is by no means a COVID trick. It has long-term value proposition, but it certainly can be hugely beneficial to making sure that the most vulnerable populations can stay out of risky environments.
And to that end, Jasmine, when you and I chatted before this event, you said that one of the things that you're hoping to impress upon people is that telehealth isn't exclusively for rural populations, that there's a real significant urban population that could benefit from telehealth services. So could you just talk for a couple of minutes about that?
Oh, absolutely. The rural population is very important, especially here in Maine, but we also want to acknowledge that there's challenges for all of our patients, even in quote unquote urban settings, to getting to their doctor's offices, whether it's because of economic reasons, not having a car or money for the bus, or it is family reasons, not being able to take time off of work or have childcare. There are significant benefits for all of our patients, including those in the urban setting. And that's why we're so focused on the Medicare reimbursement in terms of the waivers that we're all most looking at. I think being able to continue to provide video visits to patients' home, regardless of rurality, is one of the ones we're most concerned about, because these patient populations that would be benefited by telehealth are pervasive across all. I mean, even, if I'm sick, I don't want to go anywhere. If I can talk to someone and get a prescription for something from my house, I would love that option, whether my doctor's office is 10 minutes away or not.
Great, thank you. Next question, Strawberry, please.
Question from Nan. What skills are you looking for in new grads with regards to telehealth, both health profession grads and IT grads?
Oh, I love that question.
I do too. And hi, Nan. We've been working with Nan for a number of months. She's with the University of New England, and I will tell you, we have gotten more questions. We serve a large region, more colleges and universities with training our health professions workforces, really reaching out to say, we really need to incorporate telehealth training into our core curriculum. And I think they're right. I think our healthcare organizations and systems are going to expect providers to be able to use telehealth and technology to provide care, especially as the policy continues to expand. And so it's those, we've talked about website manner and making sure that you understand how to use the technology correctly. It's that multidisciplinary care, all of the things that we can leverage and take advantage of with telehealth. I think those are going to be the core sort of training components within a curriculum, for example, in developing for different health professions. So I'll let Rob and or Jasmine hop in and add more.
Yeah, we're working on a series of public service announcements that are targeted to high school and junior high kids, especially during the pandemic, that states two things. First, take care of yourself. Second, take care of your family. And for many of these kids, we're asking them to understand that that device that you carry in your hand every day could be a lifeline to mom and dad or grandma and grandpa's provider for healthcare. And so we're trying to promote this to where kids are actively thinking, how can I help my family members access healthcare?
Oh, that's great. So I think we have time for one more question. So Strawberry, of the remaining questions, pick the best.
Well, that's a lot of pressure, but so this is somebody who said that they've had wonderful telehealth experiences, but they're very comfortable on Zoom and these online platforms. But what can be done to ensure that people without these advantages have similarly great experiences?
I was just going to say education. It goes to what Rob was just talking about, the PSAs. the more education that we can provide and the better resources that we can offer. Our education and training team here at Maine Health did a fantastic job putting together Zoom videos to show them not only how to use Zoom when you're here, but also small videos on how to download it from your phone, because you might have a phone, but maybe not used to downloading apps, and that exists. And so I think just the more resources that we can provide and the more education that overall people have, and the use. I mean, you lose the skill set if you don't use it, but the more that people use it because they have to use it for school or for work, using it for their healthcare will not seem as far-fetched.
And there are some wonderful resources out there for no cost, and I can share those with Carol to share out with everybody, because I know we don't have time to share them today, but.
Yes, that's what I was going to ask, if you could supply us, excuse me, with some of the links for some of these resources that you've all touched upon, so that the folks in the audience can explore them at their leisure. We'll post them on our event landing page, which is where we're going to also post the recording of this session. So let me thank our panelists. You guys were terrific. I really appreciate you taking the time out of your busy day to share your expertise and your insight on this issue. I thank all the folks who logged in. I'm finally getting to say logged in rather than tune in, who joined us today to listen to this discussion. I appreciate our sponsors as well. And if we were doing this in our normal habitat, which is the Portland Public Library, where we were doing business breakfast forums, you would hear thunderous applause right now. So again, thank you very much for your time. We really appreciate it. And to you in the audience, check out pressherald.com and you can get all of this information available to you. And with that, I'm going to say thank you again. Enjoy the rest of the afternoon, and we'll see you with Making It Work next time. So take care.